Welcome back to Living Out Loud. I'm Susan Karp, the Executive Director of the Arlington Council on Aging. Today we have two special guests. I'd like to introduce Mara Klein Collins, who's the Chair of the Council on Aging Board, and Jim Muncy, who's the Vice Chair of the Council on Aging Board. So welcome, Mara and Jim.
Good morning.
So as we come together, the Council on Aging does have support of a town-appointed board, which has 9 members. That board works in concert with the director, which means we work hand in hand. So Jim and Mara, I turn it over to you. You can talk a little bit about why you're here today, some of the things you'd like to cover.
Sure. What we're going to present today is a presentation we created over a year ago for town leadership and also for our own education, and we've been presenting it around town to have people have an understanding of both the work we do and how we're funded. Also how we're funded in comparison to other entities within the town. And it's been very enlightening for a lot of people. So we're going to run through it right now. One thing I want to let you know is the stats were based on the 2015 budget and My Senior Center, which is a software program we use to track usership at the Council on Aging. We will be updating this once we have the final budget for this year and the final tally for the fiscal year, which ends on June 30th for the Senior Center. So we educated ourselves as a board, and what we discovered is the funding is incredibly complex. And we've had a 70% increase in growth in participants the last fiscal year, which is huge. And so now it's how do we serve all these people? So one of the things we'd like to do is, from the better statistics that we have from the My Council on Aging software, is get an understanding of what people are participating in, what we want to increase, and who we're serving. And we should add that that software is funded for us by the Friends of the Council on Aging, and we thank them profusely. Now, given last year's increase, the statistics right now is more than half of the baby boomer are becoming seniors and will want to age in place, i.e. stay in their homes. And so part of our mission going forward is how do we make that happen and support the seniors in town to do that. So we're going to need changes, and we're going to need to do things differently. The biggest one is the physical plant of our building is not user-friendly, and we've been addressing that over the last year, and changes are coming.
Right, and if I just may interject here,
Sure.
since it's a perfect idea, is that on June 15th, which is Wednesday, June 15th, from 7 to 9, there will be an open hearing, if you will, and a presentation of some of the draft ideas for the renovation of 27 Maple Street to improve our usage of the building.
And we're really excited about that.
Right.
That's being held at the town hall on the second floor.
Yes, second floor. Thank you, Jim.
You're welcome.
Thank you, Jim.
The other thing is we have a great board, and you'll see on the slide who our board members are, but included we have a nurse, we have 2 town meeting members, we have an internationally recognized expert in Alzheimer's disease and related dementias, we have an elder law attorney, we have a senior housing expert, and so we have a policy person. So we have a very, very broad set of skills, which has been really helpful because we all look at things in a different manner. So we're very excited about that. We also have clergy, which is terrific. So what I wanted to talk to you about is the mission statement, and I'm going to read from this. The Council's primary responsibilities are to design, promote, and implement services to address the needs of the community's elder population and to coordinate existing services in the community. So what that means by services is everything from social services to transportation to programming. We're lately doing a lot of evidence-based programming, seeing great results coming from it. So that's really what our mission is. And so what I'd like to do is hand off to Jim, who's going to talk about who do we serve.
Good morning again. My presentation is in my hand. I was hoping it would be in front of me so I could look at the camera more often, so please excuse me looking down quite frequently. This is a new experience for me. And so let's start with who do we serve? And the total population in Arlington, again from the 2010 census, is 42,844. Of those, 9,400 are seniors. That's almost 21 to 25% of the town population is seniors.
Right, and Jim, if I may add, from the 2010 census of 9,400, we're really just in about the 11,500 that are 60,000 and older in Arlington at present date.
Perfect. And the Massachusetts Council on Aging estimates that by 2025, there'll be a 50% increase in seniors in the state. So Arlington is looking at 18,000 seniors by 2025 as the boomers age, and I'm one of them.
Go, Jim.
Yeah.
Count me in. I'm
Yeah.
a boomer.
I'm a boomer. And the people that I meet throughout the council and other areas, and all you van riders know who I'm talking about, those are my peeps. I relate to the issues that they have, and I relate to the challenges that are faced when they come to the council. So I take this very much to heart, that we want to make a lot of improvements as soon as possible in some cases, and others are going to have to wait, but they're coming. So let's look at Arlington by the numbers. It can get really tedious very quickly, but let me just point out a few things. People assume when you talk about seniors, a lot of them think that it's 65 and older. It's actually 60 years of age and older. And the average age of Arlington seniors is 70 years old. 5,305 of the seniors are served by the council during the fiscal year 2013-2014. That's an increase of 70% fiscal year over fiscal year. And in case you don't know, our fiscal year runs July 1 through June 30. We have over 3,200 low-income seniors, 517 seniors in low-income housing, but 70% of the seniors in town own their own homes.
Can I interject? Which means 70% of the seniors pay property taxes.
There you go.
That's a big number to the town.
Okay. Yes, it is. I think the seniors who are in town don't really understand how much the council can do for them. And I prepared a little guide to help you see some of the opportunities that you can connect with at the Council on Aging. And you can find this on the arlingtonmass.gov website. And if you just click on departments, and then Health and Human Services, then the Council on Aging, and finally the Senior Services Directory. And when you click on that, it's going to bring up a 24-page document of different services that are available to you, not just by the town, but other agencies that we have in contact with to help you with all kinds of issues. And it's really eye-opening when you see it for the first time. I have personal friends who had some issues that they needed to have help with. And when I brought them to the council and connected them with the people who could help, they were floored by how much the council could do for them. Now there's a slide that talks about the population of women and men in town. And as again, by the Arlington by the numbers, 48% of seniors live alone. And one of the things we like to do is get them out of their house and come to the council and socialize. Have some activity, have some exercise, have some entertainment, have some food. But get out of the house and meet people and meet new friends. And a lot of the people who I meet who come to bingo aren't there because they're going to get a big winning. They're coming there because they're interacting with their friends that they've made over the years. And they come every single week, and it's such a pleasure to see them. 59% of the Arlington seniors are women, and 41% are men. And I'm sure there's some joke in there about why they leave before and the women still live, but we'll just let that one slide.
Yeah, we'll let that
Yeah.
slide.
Now, there's variable funding sources for the Council on Aging, and I want to draw your attention to the area in white. That's the area that is variable every single year, and it's a challenge trying to get as much money as we need to provide the services that we have. The municipal government and allocations from the state comprise about 46% of the budget. If you look at the non-paid workers, that's 18.4% of our annual budget is covered by volunteers. And we thank you.
Yes, thank you.
It could not be done without you, and your value to the council is just unbelievable. We'd be dead in the water without your help. And we computed that $96,000 figure by just taking an average of $12 an hour over the course of a year, how many hours the volunteers provide services, critical services to the council. You're up.
So part of what we looked at was the town budget and comparing ourselves to other town offices. So just to give you an idea, the Council on Aging funding is 0.17%, not 17%, not 1.7%, 0.17%. To put it in perspective, the funding for the Council on Aging equals the funding for streetlights in Arlington. The board laughs at me because I keep saying I'm going to have seniors show up to voice their opinion on funding with light bulbs in hand. But, you know, part of what people might say is, but seniors use town services like police, fire, EMTs, which is paid for by insurance and Medicare, but so do the other populations. And we're not using the schools. We believe in funding the schools. You know, many of the seniors had kids in school and advocated in that realm also. But I think it's really interesting to know that our budget is generally around 230 for this year. That year it was 230,230. So I just want to make you aware of that in the whole context of things. And as the senior population ages and we're homeowners, what it means is we're going to need a lot more services, but we're helping pay for services, so we want a bigger piece of the pie. So that's something that I think is really important and for you to understand, and also in terms of talking with people about understanding the funding. The other statistic that we heard was that we are almost equal in percentage to the number of school children in Arlington. So that's significant also. And to keep that in mind, and this population, the board believes, is underfunded. So food for thought. So what we're looking at, the needs, so okay. So the schools get 37% of the budget. That's 37%, not 0.37, not 3.7. It's 37% versus our 0.17. I know I'm beating it to death, but it's important, folks. And so that's important. The libraries get 1.6%, which is a little bit over $2 million. And I'm a big user of the library. We're not saying that none of these should be not funded, just that we need a bigger piece of the pie. And so going on from that, the needs of the Arlington seniors, Jim's going to talk a little bit about that, what we're seeing as the need now and as it increases.
And one of the things I want to cover before we move to the needs is the grants that we get. Sanborn for $30,000, the Service Incentive Grant for $4,000, the Sims grant for $15,000. The Friends of the Arlington Council on Aging gave us $8,075. And we also got a grant from Leahy Medical Center. One of the things that I don't, again, think that people are aware is how valuable Susan is in getting grants. She's written and won several unique grants. Some are one of only a few awarded in the country, not just Massachusetts, in the country. Most grant programs are evidence-based federal health maintenance grants. And without Susan pulling in all of the grants she does, the budget for COA would be extremely challenging. Not that it isn't already, but it would be even worse. So I want to thank her publicly for that, as much as that kills me.
It kills you, and really thank you. And Jim, the one thing that I want to point out with grants also is that with me not having the slides in front of me, the CDBG, or the Community Development Block Grants that I submit and the town approves, that helps with some of the transportation and some of the grant-funded positions. So sometimes we don't necessarily see that in the municipal budget, and it is a grant item. The other item about the grants is that even though applications for grants happen all the time and we submit them all the time, grants aren't there to sustain programs. Grants typically are there to fund individual particular programs. So when we look at our budget and we look at how much our grant funded, that is an area that as grants come and go, can be challenging.
It's a one-time use.
Right. Yeah. Even though with the Sanborn Foundation, they're very generous, and that is a grant cycle that we have been a part of for many, many years. Some of the other ones aren't as necessarily reliable for our ongoing business operations.
So what that means in essence is we get the money from the town, we also get money from the state, as every entity in every town and city in the state does. But everything else in our budget could go away tomorrow because it's grants, they're all forms of grants. And that's what makes us nervous. And we don't have a grant writer on the Council on Aging. We're grateful that Susan does that as part of her job. So it's important to also understand that a large portion of our budget is grant-based.
And supplemented by the value of the volunteer hours, as well as we're a very large intern site. So we partner with up to 7 colleges and universities that provide us year-long interns, typically in social work, as well as the different institutions that provide us the nurses that come to do their community health rotation. So we can have anywhere from 6 to 8 per semester. So even though we do have the interns and it helps offset the gaps where budgets and personnel and needs, where there's the gap, we do spend a lot of administrative hours in preparation for both the volunteers as well as the social work interns, thanks to Marcy and Lori, and then Mark for nursing.
And speaking of the transportation area, that's near and dear to me and my peeps that I see every week. But in listening to a lot of the people who ride the vans and we encounter in the council, there are issues that are facing the senior center that need to be addressed. And some of those needs are private offices for seniors discussing issues with staff. I'm also someone who has volunteered to work with people on fuel assistance, and you have to have private offices for that. When Shine counselors come in, you have to have private offices for that. And the nurse, and it goes on and on and on. We have to have adequate program space. I mean, a lot of you already know that when you're in a yoga class, there's a lot of noise in the background and people traveling through your work area or your exercise area because there's no other way to get around the building. And we can't close off certain rooms. The main room upstairs, I'll say upstairs, it's the ground floor, not the basement. It's a wide open area and it's a hallway as well. It's very hard to concentrate on what's going on when people are coming and going all the time. Handicap accessible building. I know when the vans pull up to the side entrance and people have to get out, that door is not the easiest door in the world to open, and nor are the bricks and entranceways on both entrances easy to navigate, especially when you have a walker It's just a nightmare.
Remember me on crutches last winter
I
trying
tried
to get
to,
into
I
the
tried to
building?
forget that, yeah.
Well, you're basically uncoordinated anyway, so take that and crutches, so.
Thank you.
And Wednesday afternoons, when the bingo breaks up and people have to wait for the van to show up, we want adequate, comfortable seating in the front entrance area so that these people have a place to sit down comfortably, not scramble for a chair before you're playing musical chairs and there are no more and you're standing. A welcoming lobby with signage would be helpful, and easy access to handicap accessible bathrooms. And we don't want to have the ladies' room only be down the very far end of the building when there's a men's room right there that very rarely gets used. An attractive lunch site that entices you to come for a healthy meal. A well-maintained physical plant, and not always be so cold that you feel you have to bring a winter coat with you when it's 70 degrees outside. Furniture that's easy for seniors to get in and out of, rather than have just a fold-up chair. How about chairs with arms, enhanced lighting, better temperature control, visual color cueing, and large print signs, and integrational program space. Because we have Dr. Paul Rea on our board, I've become a lot more aware of Alzheimer's disease and the impact that it has and the area that it encompasses. I used to think it was a narrow medical term, but it's not. It's a big umbrella term. And we have to look at caregiver support and try to help those people who are spending so much time, family time, with their siblings and relatives and friends, trying to help out taking care of people who are challenged with the different diseases under the Alzheimer's umbrella name. And we need to plan for increased needs for the seniors as they age with chronic conditions such as cancer and arthritis, diabetes, and Parkinson's, and so on. Right now, the population is what it is, but it's going to grow dramatically, and we need to be able to cover those needs.
Susan, one question I have along those lines, because you're probably seeing it, that as the senior population ages and where people are living longer, you may see a senior who's a younger senior caring for an older senior, so it's affecting two people in the senior population.
A
Are you seeing an increase?
70-year-old caregiving for a 90-year-old, yes.
Mm-hmm.
We've been seeing that for a number of years.
Yeah. So that's something to take into account too. And if something happens to that younger caregiver, who's going to take care of the elder senior? So it's just an overwhelming, it's an overwhelming issue that's only going to get worse with time, thankfully, because we're living older, hopefully living older and healthier, which is one of our goals. So that brings us to what are the goals that we've defined for ourselves as the Council on Aging Board. The biggest one is improvements to the senior center. We're just really excited that there is funding coming, that people have listened to us, that we've been working with the various offices in town, including the new Director of Planning, who's come right on board and seen what we need, and that we're being heard. So that's significant, and we really appreciate everybody's efforts on that. And please, please feel welcome to come to the meeting next Wednesday evening. I'm looking forward to seeing the plans. I'm looking forward to walking into the senior center in the not too distant future and having a welcoming lobby with people sitting around where I can sit and talk with people. There isn't a staircase there that makes you go, oh my God, how am I going to get up that? And that it's just a warm, welcoming environment. And with the ability to put on many different programs of different sizes. I mean, that's the vision that we have.
So let's reiterate, June 15, 7 p.m., second floor, Town Hall. Be there.
Thank you.
Thank you.
The other thing is we look at staffing. At one point we had a full-time geriatric nurse. We now have a part-time geriatric nurse. We'd like to reinstate funding for that. Thankfully, we have all of the interns that we have, the nursing people, the nursing students that are actual nurses, but they're on their clinical rotation. It's an enormous value to us, but we need someone leading the charge full-time in Arlington. We want to reach the Executive Office of Elder Affairs best practices on staffing. We want to ask for additional municipal funding as our senior population grows. Things like even having a full-time administrator to help so that Susan can focus on the things that make a big difference in the big picture, such as the grant writing, which helps us so much. And last, programming. We want to create programs to support caregivers. We want to increase programs to educate town employees and emergency responders on best practices for seniors. I recently got to observe a meeting and really watch how the Board of Health, the Council on Aging, the police department, how everybody in town really works together to provide for the seniors in this town. And I found it very, very, just very
Enlightening?
enlightening. Thank you. That's a good word. I obviously needed more coffee today. But it was really eye-opening, and to also get the reaction of some of the professionals that were at this meeting also that weren't aware of some of the things that we get involved in at the Council on Aging. Everything from people being scammed financially to people being able to afford medications to medical situations, people being home alone, getting people together. Susan formed an LGBT group that's getting together and doing programming.
Transportation. So it's really very difficult, even in our short program that we have, that we film every Thursday, because we do so many different things. One phone call for transportation really can lead us to a number of other things. And certainly with the staff that we have, social work with Marcy and Lori, nursing with Mark, Joyce with information referral. I am oftentimes fielding phone calls as well. We basically are a connector to many other sources. So with regards to budgets, with regards to different funding sources, staffing models, these are all things that I feel very fortunate as an executive director to have a board that is so experienced in aging services as well as other areas that complement, that we're able to work together and plan. Because as we know in municipalities, you have an idea and it can be 1 to 2 budget cycles before we can start increasing that visibility and examining level service. What does level service mean? But I know that we have a lot of information, and I was just wondering if there are a few other things that you would like to wrap up with, because our time this morning is coming soon to a close, and there's so much more information, so perhaps you and Jim might be able to come back on another day as well.
We'd love to.
Well, I'm just thinking
yeah.
a little wrap up is, I had to talk her out of this, but she wanted to wear a light on top of her head to draw attention to the fact that we have a budget from the town of 0.17%. And we'd like to do something positive to increase that. And you're the key to that, so help us out.
And I'm going to add to that, it's really what I said the last time I spoke is, many of you advocated for your children when they were in school. Well, now it's time to stand up and advocate for yourself and your fellow seniors. It's time for this population that pays a substantial amount of taxes to the town to stand up and say, we want more, support us. We want what we're due.
Right, and I would really like to say thank you so much for coming, Jim. Thank you for coming today. Mara, thank you. And thank you for joining us on Living Out Loud, and we'll see you next time.